Hello students, welcome to All About Nursing channel. So today's video is going to about the Trenexa or tranexamic acid. So the mode of actions, commonly used doses, and the uses of tranexamic acid or Trenexa. So Trenexa is a oral form which is given at the common dose of 500 in a tablet form. So the basically it acts as an antifibrinolytic agent. So antifibrinolytic means fibrinolytic means which breaks the fibrin. Fibrin is a clotting means the clotting factor, or the which known as the blood clot. Fibrin means the blood clot. So fibrinolytic means which break the fibrin. So the tranexamic acid acts as an antifibrinolytic, means it acts against the fibrinolytic action, means which basically helps in formation of fibrin or blood clot. Antifibrinolytic means breakdown of the fibrin, or anti means the opposite form. So it helps in the formation of fibrin. So the tranexamic acid blocks the plasminogen activation, so that leads to plasmin formation, and from there it inhibits the clot degradation, so it prevents the clot degradation. Clot degradation means the simplification form is clot degradation means the breakdown of the clot. So it prevents that, it inhibits that. So when it inhibits the clot breakdown, means it promotes the clot formation and reduce the bleeding. So uses commonly used means the area where we can use the tranexamic acid. The commonly used areas are heavy menstrual bleeding, surgical or procedural bleeding, nosebleeds or epistaxis, postpartum hemorrhage, and hereditary angioedema. Okay, so in that cases common. In other where the bleeding is not stopped, so in that different cases there are different areas where we can give tranexamic acid. So this is the commonest areas where we can use. So the commonly seen side effects are headache, dizziness, nausea, abdominal pain, diarrhea, back pain, muscle pain. So the common doses are for heavy menstrual bleeding in menorrhagia. The dose is 500 mg to 1000 mg, 1 to 2 tablets thrice in a day. So depending on the prescribed physician, so depending on the prescription of the physician, so depending on that the medication is given. So for surgical bleeding in dental surgery or different surgical bleeding, so there you can give 1 gram or 1000 mg tablet thrice, or what PD or TDS we can give. Next, for trauma related bleeding, where we can give 1000 mg TDS. So all the doses, all the indications are depending on the physician's order. So depending on that the patient has to consume the medicine, but overall the doses are given like this in case of heavy menstrual bleeding, in surgical bleeding, in trauma related bleeding. There we can give 500 to 1000 mg. The doses are available. We can give orally, we can give IV also.